Welcome to Module 4, Introduction to Sexually Transmitted Infections. This is the fourth lecture in the Qualified Professional Test Counselor Certification course. My name is Philip Chan. During this lecture, we're going to talk about a basic introduction to STIs. We're going to talk about the epidemiology, which means who's infected for common STIs. And then we're going to talk a little bit more about some of the common ones, including chlamydia, gonorrhea, syphilis, HPV, and genital herpes. The reason why it's important to have a basic understanding of other STIs is because these do impact both the transmission and treatment of HIV, as well as oftentimes during the course of counseling is that you'll receive questions about these other STIs in general. It's important to understand these basic STI-related concepts given in general to promote education awareness, to recognize some of the common STIs. Again, they're associated with increased risk of HIV transmission, and to be able to provide effective prevention counseling, not just for HIV, but also for these other STIs. What is the epidemiology of common STIs? So here's a complete, a comprehensive list of all the STIs that we currently know of. You can see HIV, gonorrhea, chlamydia, syphilis, HPV, human papillomavirus, human simplex virus, HSV, pubic lice, crabs, hepatitis A, B, and C, although hepatitis C is less commonly transmitted through sex, and you'll hear more about that in another lecture. Trichomonas, bacterial vaginosis, and then there's a number of other rare STIs, but ones that we occasionally see. There's only 5 STIs that are reportable. These include HIV, hepatitis A, B, and C, gonorrhea, chlamydia, and syphilis. And why are only certain STIs reportable? The reason is because timely reporting can lead to prevention and control. So for those 5 STIs, when people are notified in a timely manner, when there's contact tracing, it can break the chain of transmission and lead to treatment and infected contact. So the reason why those 5 STIs are reportable is because reporting them and having early intervention can actually limit the spread of disease. There's other STIs that are just so highly prevalent that that it doesn't really make sense to report them because there's no way that you can really interrupt the chain of transmission. These include some of the STIs such as HSV, herpes simplex virus, as well as HPV, where as you can see here, especially for HPV, up to 80% of the population is infected with HPV at any one time. There's also very low morbidity and certainly mortality associated with these STIs, and there's also no effective cure. So even if we diagnose someone with some of these STIs, there's not much we can do. When you look at the most common STIs, you can see that HPV is by far and away the most common STI here in the United States. In terms of populations that are disproportionately impacted by STIs, it's really youth and young adults. And you can see here for ages 15 to 24 is that they make up a significant proportion of people infected with different STIs. Talk about one of the more common STIs that we do see. This is chlamydia infection. Chlamydia is caused by the bacteria Chlamydia trachomatis. It is the most frequently reported bacterial STI in the U.S. As you saw in the previous slide, HPV may be the most common, but chlamydia is by far the most commonly reportable bacteria STI in the U.S. In 2015, there were over 1.5 million cases. Younger people, especially those 14 to 25, are the most affected, and it's estimated that 1 in 15 sexually active females, younger females, have chlamydia. And as with a lot of other diseases, unfortunately, it disproportionately affects African American and Hispanic Latinos. Chlamydia rates are highest in urban centers and also in the southern United States. This is another graph showing the different regions of the United States and how the South has the highest rates. Women are also disproportionately impacted by chlamydia, seen by the light gray line here. However, the important thing is that chlamydia rates are increasing in the United States. One of the reasons that women are have a higher number of cases, though, is not necessarily because they are infected more. It's because women tend to be screened at a higher rate, and therefore they're diagnosed more often. So we actually suspect that men and women are infected in equal numbers, but we're just able to more commonly find women with chlamydia because women are more likely to present for OB/GYN exams, etc. The highest risk age group for those with chlamydia are people aged 20 to 24 years of age. You can also, though, see that there's a significant bump, especially for young people aged 15 to 19 years of age. As I mentioned, African American, Blacks, and Hispanic Latinos are at a disproportionate increase of chlamydia infection. In Rhode Island, compared to other STIs, we see a significant number of chlamydia cases. So in 2014, we saw over 4,000, and this continues to increase. Approximately 70% of those cases were among women, with the majority younger. You can see over the last decade that the cases of chlamydia have just continued to increase here in Rhode Island. Females are predominantly impacted. However, again, this is probably not because females are more likely to have chlamydia. It's just because we do a better job of identifying chlamydia in females. Younger age groups tend to be affected, especially those 20 to 29 years of age. And you can see the majority of cases are really being diagnosed in the Providence area with over 1,600 cases in 2014. You can see that there's other regions of the state with significant number, but Providence, the majority of cases are really being diagnosed in and around Providence County. Risk factors for transmission of chlamydia. Age is the strongest predictor, meaning that those who are younger are most likely to be diagnosed. Those with multiple sex partners, people who don't use condoms, having a prior STI also increases your risk, as well as those from lower socioeconomic status. The incubation period of chlamydia tends to be 7 to 14 days. This means from the time that you're infected to the time that you show symptoms tends to be upwards of 2 weeks. The most important thing is that most people tend to be asymptomatic. This means that they do not have any signs or symptoms at all. This is up to 50% of women and up to 90% of men. When people do have symptoms, the most common symptom is cervicitis or urethritis. This means that the urethra or cervix in women tend to be inflamed. You can sometimes get a little bit of a drip or some exudate. There's a number of other complications that we can see in chlamydia. These include inflammation of the liver, known as perihepatitis, which also has a name known as Fitzhugh-Curtis syndrome. The most concerning complications of chlamydia occur in women. These include things like pelvic inflammatory disease, ectopic pregnancy, and infertility. These are diseases that can be life-threatening, especially ectopic pregnancy and pelvic inflammatory disease. These can be very, very serious and life-threatening conditions. They only occur in a fraction of women who are infected, however, lead to a significant cause of morbidity. In terms of diagnosing for chlamydia as well as other STDs, the CDC does recommend that all sexually active women younger than 26 years of age are screened annually for chlamydia. For men who have sex with men, they should be screened yearly or every 3 to 6 months, especially multiple sexual partners. In men, probably the biggest concern for chlamydia infection, given that 90% don't have symptoms, is that it actually increases your risk of HIV infection. So especially in groups of populations, such as men who have sex with men who may be at risk of HIV infection, it really makes sense to aggressively screen men for chlamydia and other STDs so that you can address their risk of HIV infection. Pregnant women should also be screened during their first prenatal care visit, and those under 25, certainly with multiple sex partners. The diagnosis of chlamydia is through what's known as a nucleic acid amplification test. This is known as the NAT test. In general, is collected through a urine specimen. In general, we do not tend to do swabs. but people tend to pee in a cup, and we check it through that. Chlamydia is easily curable. In general, people are treated with azithromycin 1 gram, which is given as a pill once, and that is very, very effective in curing chlamydia infection. Occasionally, people may not tolerate the azithromycin or may need another medicine. The second-line treatment is doxycycline, 100 milligrams twice a day for 7 days. It's important to note that once you have chlamydia, you can get it again. Immunity to chlamydia is not lifelong, i.e. reinfection is common. And the most common cause for having someone that, quote, gets chlamydia again is that their partners were not initially treated. So in general, the treatment with antibiotics doesn't fail, but people tend to be reinfected. In general, also, we do not test for cure. We assume that once we treat people, they are cured. One of the reasons for this is that because the tests are so sensitive that sometimes that they're positive even when people have been cured, because you're picking up dead bacteria that's just sitting around in the urine test. So in general, we do not test for cure. If you do, we do recommend checking for at least 3 weeks later, or if a person is symptomatic. There's a number of other causes of urethritis. These include gonorrhea. We'll talk about that in a second. But there's a number of other causes of urethritis other than chlamydia. In general, chlamydia is the most common. The other causes that we do see include Trichomonas vaginalis, Mycoplasma genitalium, Uroplasma, HSV, adenovirus, and syphilis can all cause symptoms of urethritis. Gonorrhea. So gonorrhea is caused by the bacteria Neisseria. In 2015, there were over almost 400,000 cases of gonorrhea in the U.S. It's the second most common reportable STI, other than chlamydia. Overall, we've made significant advances in controlling gonorrhea. However, in the last few years, and I'll talk about, we are seeing increases again in gonorrhea. And as with the other STDs, gonorrhea is most common in the southern United States. This is what's happened over time for gonorrhea. Penicillin, which gonorrhea was initially sensitive to, came out in the late 40s. You can see that at that time there was significant decrease in gonorrhea, and then over time there was a significant bump in the 70s and 80s, which has since that time come down. Gonorrhea is most reported in the South. You can see by the dark blue on this slide. Again, this is another graph showing the different regions of the United States, demonstrating that gonorrhea is most common in the South and then second in the Midwest. Age groups, similar to chlamydia, we see younger age groups. Those 20 to 24 years of age are most likely to be affected and infected. There's also a significant bump though in the 15 to 19-year-olds, as well as late 20s, early 30s. As with chlamydia, there's a disproportionate number of infections among African American blacks as well as Hispanic Latinos. In Rhode Island, in 2010, there were 291 cases. However, in 2014, this increased to 590. So we've definitely seen a significant increase of gonorrhea here in Rhode Island, and this is the highest number in the last decade. In contrast to chlamydia, almost 60% of the cases are male, and what we're seeing in Rhode Island is that gonorrhea is especially the increases are especially due to sexual risk, especially among men who have sex with men. This is a graph for the last decade of gonorrhea in Rhode Island. You can see 590 cases in 2014 is the highest number that we've had in the last 10 years. In terms of age groups that are infected, 20 to 29-year-olds, there's also a significant bump in those 19 years and younger, and as well as those in their early 30s. We do similar to chlamydia. We also see the majority of cases in and around Providence County. In 2014, there were 250 cases in Providence, with a number of other cases located in other districts throughout the state. Risk factors for gonorrhea transmission, again, include age, which is the strongest predictor, having multiple sex partners, being unmarried, racial ethnic groups, not using condoms, having a history of prior STIs, or lower socioeconomic status. The incubation period from when you're first infected to when you have symptoms tends to be 4 to 8 days, similar to chlamydia, but less likely so. A lot of people tend to not have symptoms. So up to 50% of women may be asymptomatic, and 10% of men. People with gonorrhea tend to have more symptoms compared to chlamydia. Again, the majority of symptoms do tend to be cervicitis, urethritis, or proctitis. With chlamydia, with gonorrhea, though, you can also have a sore throat or pharyngitis. It can also affect your liver. You can get the perihepatitis with the Fitzhugh-Curtis syndrome. And similar to chlamydia in women, you can have a number of severe complications, such as pelvic inflammatory disease, ectopic pregnancy, and infertility. Gonorrhea may also disseminate in a very few percent of the cases. This means that it may infect your blood and cause things like joint pain, tendinopseuditis, which is inflammation of your tendons, as well as dermatitis, and cause pustules and skin rashes. Gonorrhea can be transmitted through secretions of the penis, vagina, mouth, or anus when someone comes in contact with the infected mucous membranes. It can also be transmitted during birth. It is not often transmitted through saliva. It can also infect, importantly, the mouth, throat, or anus. We do recommend, especially in high-risk populations, such as men who have sex with men, that people do have swabbing, both of the mouth and the rectum for gonorrhea infection. Similar to chlamydia, the recommended test of choice is nucleic acid amplification testing. This includes testing of the urine, the urethra, the oral or the rectal sites. Sensitivity, again, is 98 to 100%, very sensitive. It can also be cultured out in labs. You can check it on so-called Thayer-Martin media, and also you can see it on gram stain as well. Treatment of gonorrhea is recommended to have a shot. This is a shot in the muscle of ceftriaxone, 250 milligrams once, plus azithromycin, 1 gram orally once. We use 2 medicines to treat gonorrhea because there's increasing resistance that's being seen in the community. Instead of azithromycin, you can use doxycycline. However, azithromycin is a preferred medication. We do not recommend using just one medicine alone because of the increasing rates of resistance. Syphilis. Syphilis is one of the long-standing STIs. It's caused by a bacteria known as Treponema pallidum. It was discovered in the late 1400s. It's actually believed to have been introduced to Europe from Americas by Christopher Columbus, and the first large outbreak was witnessed in 1494 in the context of a French army invasion. In the United States, there's an estimated 55,000 new infections yearly. MSM account for approximately 82% of all cases in 2015. And as with other STDs, different racial and ethnic minority groups are disproportionately impacted. As with the other STDs, the majority of syphilis cases are observed in the South, with the West in second. In contrast to other STDs, so we do see a little bit older age distribution for syphilis. You can see here 20 to 29 are the major age range, but there's also significant numbers in their 30s and 40s as well. By far and large, MSM are the group most impacted by syphilis. And similar to other STDs, African American blacks and Hispanic Latinos are disproportionately impacted by syphilis. In Rhode Island in 2008, we were down to 25 cases of syphilis across the entire state. In 2014, though, you can see that number jumped up to 120. That was an exponential increase over prior years. 96% of all syphilis cases were among men with an average age of 36 years of age. Also importantly, 81% were MSM, and of those, 44% were also HIV positive. So we're seeing significant transmission of syphilis among MSM, and especially among those MSM that were HIV positive. Here's a graph of the trends of what we have seen in syphilis in Rhode Island. You can see in 2006, this was the lowest number of syphilis cases ever reported. We were down to 20, but you can see in the 8 years since then that we have jumped up to 120. Individuals in their 20s and 30s tend to be disproportionately impacted by syphilis in Rhode Island, as well as MSM. From 2012 to 2014, the majority of syphilis cases occurred in and around Providence County. You can see there was also a significant number of cases in Newport. In terms of thinking about syphilis, syphilis is divided into a number of stages. There's 4 stages: primary, secondary stage, as well as the latent and tertiary stage. The primary and secondary stage really signify that you've been infected, usually within the last year, and are also the 2 stages that when you're most likely to infect others. So the most common symptom of primary syphilis is a painless ulcer known as a chancre. The syphilis itself tends to be highly infectious, especially that chancre, and it's estimated that up to 30% of people may get syphilis when exposed to the syphilis chancre. Syphilis has a little bit of a longer incubation period compared to chlamydia and gonorrhea, which we just talked about. The average incubation period tends to be anywhere from 10 days to up to 3 months, with the average being 21 days. This is important to keep in mind for people that may have an exposure. In terms of symptoms of syphilis, syphilis is known as the great pretender. Even for people that are highly experienced in syphilis, the signs and symptoms of the disease are easily missed. As I mentioned, there's 4 stages of syphilis. The primary stage tends to be a painless chancre. It's easily missed. It can sometimes be on the inside of the rectum, vagina, throat. Even if you do nothing, it tends to spontaneously heal within a few weeks without treatment. The secondary stage of syphilis occurs in 25% of individuals, and that's where you get systemic dissemination of the bacteria, and the most common symptom is a rash that may appear especially on the palms and soles, and people may also get enlarged lymph nodes and fever. Syphilis will then enter a latent stage where there's absolutely no symptoms, and 25% of people may go on to develop tertiary syphilis, which occurs years to decades later, and it often involves neurological signs, cognitive decline. It can involve ocular involvement, as well as cardiovascular heart involvement, or nodular lesions, which can occur throughout the body. Unfortunately, syphilis is still one of those diseases which we actually cannot grow it in culture. This hampers the diagnosis. In general, there's 2 tests called the non-treponemal or treponemal tests, of which there's a number of different assays out there. But essentially, it's a blood test that tests for the presence or absence of the syphilis antibody. Treatment for syphilis. Syphilis tends to be highly sensitive still to penicillin. For people that have been infected with syphilis for less than a year's time, they're treated with 1 shot of penicillin, of benzathine penicillin G, 2.4 million units once. For those that have been infected for longer than a year's time, they get a total of 3 shots once weekly over a total of 3 weeks. For people that may have neurological involvement, because these antibiotics do not penetrate the brain tissue as well, it is recommended that people with any neurological involvement of syphilis receive 10 to 14 days of intravenous penicillin every 4 hours. So this is something that has to be administered through the hospital or at a nursing company. For For those that may be allergic to penicillin, another option can be doxycycline or ceftriaxone. However, if at all possible, we do recommend treatment with the penicillin since syphilis is highly sensitive. A couple other notes about some other STDs. So human papillomavirus, HPV. HPV is a virus with many, many different subtypes. It's the most common cause of plantar and common warts. It also can cause anogenital warts. It's also specifically associated with different types of cancer. So HPV types 6 and 11 can be associated with cancer of a number of different sites, including oral as well as the genitalia. In people that have cancer with HPV, type 16 and 18 tend to be the most common cancer-causing types of HPV. HPV is the most common STI in the world. It's estimated that upwards of 80% plus of anyone who's sexually active will get it at some point in their lives. In terms of genital warts caused by HPV, again, infection with HPV types 6 and 11 are the most common. It's associated with new sexual partners, having a higher number of sexual partners, skin-to-skin contact. People with HIV are more likely to get genital warts with the lack of condom use, as well as more common in different racial and ethnic populations. In terms of signs or symptoms, genital warts infects the skin cells that are called the squamous cells and causes them to mutate and proliferate. As I mentioned, they can really occur anywhere from the lips, the tongue, the palate, the cervix, penis, etc. They can appear as cauliflower-like, or they can also appear as different papules or other warts. They can really appear as almost anything. The major complication of HPV is that virtually all causes of cervical cancer are caused by HPV. In terms of diagnosis and treatment, diagnosis is really made clinically. In some situations, you can perform testing for the HPV virus itself. Some people, especially if they're concerned of cancer, may need to have a biopsy or a colposcopy. In terms of screening for cervical cancer, it is recommended that women have pap smears every 3 years. Treatments sort of depend on what the disease by HPV, which is caused for warts. There's creams, there's cryotherapy, freezing, there's acid treatments or excisional treatments, which can be performed. These are performed by specialists. In terms of cancer, workup is with an oncologist, and it can involve radiation or surgery. There are a number of different vaccines out for HPV. There's the Gardasil vaccine, which was licensed in 2006, as well as others. These tend to protect against the most common cause of cancer-causing HPV strains, as well as the wart-causing strains. These vaccines, one of the most important points about these vaccines is that they're most effective in people that have never been exposed to HPV. This means that people should ideally be vaccinated prior to their first sexual experience. In the vaccine guidelines of the United States do recommend that women aged 9 to 26 years of age and men 9 to 21 years of age be vaccinated. And ideally, you're offering this vaccine to individuals when they're 11 to 12 years of age. Genital herpes. Genital herpes is also one of the most common causes of STIs in the United States. You can see over time that the number of physicians' visits here in the U.S. For genital herpes has increased, and this is visits in thousands. Genital herpes can be caused by is caused by the herpes simplex virus, either type 1 or 2. It is estimated that approximately 16% of people aged 14 to 49 have HSV-2 infection. Genital herpes has historically been thought as of the cause of HIV-2. However, infections are much more being identified as being caused by HSV-1. And with other STDs, there's also a disproportionate increase among different ethnic and racial minority groups. Genital herpes is contacted with through skin contact with lesions, mucosal surfaces, genital secretions, oral secretions. The highest risk is when people have symptoms. So genital herpes tends to present as lesions, a number of grouped vesicular lesions, and the most common time to transmit is when people actually have symptoms present. There is still some risk even when people have no rash and have no lesions, and that's an important note to counsel people on as well. Because genital herpes tends to be so common, and because there's not a whole lot we can do about it, we do not routinely screen for it. For people that have recurrent symptoms, or for people that have partners with genital herpes, we will test for it, and there are some medications that we can offer, which I will talk about in a second. But in general, we do not test for people routinely for HSV. As I mentioned, a lot of people tend to be asymptomatic with genital herpes. However, when people do have symptoms, they usually present as painful vesicles, especially around the genitals, rectum, and mouth. When people first get herpes, it can present with other symptoms, including fevers, headaches, lymphadenopathy, lymph nodes, as well as fatigue and tiredness. Incubation period tends to be 2 to 12 days from when someone, again, is infected to when they have symptoms. People with genital herpes can also have recurrent outbreaks, sometimes multiple times a year. There are some severe complications that very rarely happen with herpes, and these can include infection of the brain, encephalitis, infection of the spinal cord, meningitis, as well as eye involvement. However, these are relatively rare compared to with the number of people infected with genital herpes. The diagnosis is oftentimes made just clinical because it tends to be have a very unique presentation. There are different cultures when the diagnosis is in question that we can actually culture out the rash that will grow out the herpes virus. We can also check blood tests for the presence of herpes. The classic test is known as a Zenk smear, and that's looking at a little smear under the microscope that shows these multinucleated giant cells. Importantly and unfortunately, there is no cure at this time for herpes. Different prevention include abstinence, especially abstinence during outbreaks when people are most likely to transmit. Condoms do help reduce the risk of herpes transmission, although do not totally negate it. We also encourage people with genital herpes to inform their partners. And there's also a number of medicines that can help prevent outbreaks. Again, these are effective in helping to prevent transmission to others for people that have recurrent outbreaks. But they do not cure the disease. There's also a number of other STDs that can cause ulceration. So we talked a little about syphilis and HSV, herpes simplex virus, but there's a number of other STDs, both chancroid and donovanosis, which are very rarely seen in the United States, but can be an important cause of genital ulcers and STIs. There's also a number of other non-infectious causes of ulcers, which occasionally get mistaken as an STI. These include certain drugs. We do diagnose occasionally a case of cancer, even here at the STD clinic, that can occasionally mimic STIs. There's a number of autoimmune diseases, which can occasionally cause, and there's some natural variation as well as trauma-induced ulcers that can occasionally be mistaken as STIs. A quick note on viral hepatitis. Again, you'll get a lecture more on this later, but viral hepatitis, hepatitis itself means inflammation of the liver. The viral hepatitis are a family of viruses that infect the liver cells. The most common are known as hepatitis A, B, and C. Hepatitis A and E cause acute disease. Hepatitis B, C, and D tend to cause acute or chronic disease. And hepatitis A, B, and C can all be transmitted sexually. However, hepatitis C is very much less common to be transmitted sexually. An important note is that hepatitis C virus has surpassed HIV as a cause of mortality in the U.S. And again, you'll be hearing much more about hepatitis C in a later lecture. Also an important note, and especially among men, but men who have sex with men, given that's where we see a lot of HIV, is that STIs can increase the risk of HIV transmission. And this is the fold increase of having chlamydia or other STDs and your increased risk of HIV. So for example, having chlamydia increases your risk of HIV acquisition by 3.6-fold. So significant increases when having one STD of acquiring another. And in fact, we see this in practice where oftentimes when people are diagnosed with HIV, they likely have other STDs. So the important point is just by screening and treating in a timely manner other STDs, you actually prevent a number of HIV cases. Again, feel free to contact me with any questions. Thank you for your attention.